If you are turning 65 or are already 65, there are a number of things that you want to avoid so that you don't completely blow it in your retirement. We'll cover these today in this video, so stay tuned to find out. Hi, I'm Rick Teska, CEO and licensed advisor here at Strive Medicare. And today we're going to cover the top 10 mistakes that people make at 65 and how you can avoid them. Before we get into it, remember to hit the like button and subscribe so we can keep releasing our content. Okay, so let's get into the top 10 mistakes that are made at 65 and how you can avoid them. The number one mistake people make is waiting too long to learn about Medicare. When it comes to turning 65 and or enrolling in Medicare, we suggest that you do your homework. Learn about the parts of Medicare, A, B, C, and D, Medicare supplement plans, Medicare Advantage plans, and Medicare Part D prescription drug plans. You should have a pretty good understanding of these plans and these parts, and which ones are best for you before you enroll. Otherwise, you could be stuck in a plan that is not a good fit for you. Number 2 on our list of the mistakes is not enrolling in Medicare at the right time, in turn facing lifetime late enrollment penalties. You will automatically be enrolled in Medicare at 65 if you're retired and drawing Social Security. If you are not planning on drawing Social Security, you will have to sign up in one of 3 ways. You can manually enroll if you are on a group or employer plan where Medicare is the primary payer. Medicare is typically the primary payer if your employer has fewer than 20 employees. If Medicare is the primary payer, you will need to enroll during your initial enrollment period. If you are not retired and your employer is the primary payer, and you will have credible coverage through your employer and can enroll at a later date. If you miss these enrollment periods, you'll have to wait for the general enrollment period and you will be penalized with your Medicare Part B premium. The third mistake a beneficiary can make when new to Medicare is buying the most expensive plan. There are people who come into Medicare and just assume that the best plan is the most expensive plan. The best way to evaluate your coverage is to review your health, your providers, hospitals, and medications with a Medicare advisor like those here at Strive Medicare. Fourth on this top 10 list is getting a plan because it worked great for a friend. Many people hear from a friend that a certain Medicare supplement plan or Medicare Advantage plan has been really great for them and meets all their needs. When it is time for them to choose a plan, they go with one that their friend or family member had. I'll say it again, the best plan for you depends on your health and your needs. Just because a plan may be great for a few of your friends or loved ones does not mean it's going to meet your specific needs. It is important to understand the plans and to sit down with someone who can help you find a plan that will fit your needs. Right smack dab in the middle, and the middle number 5, is failing to understand Medicare supplement, or also called Medigap plan standardization. Medigap plans are standardized. This means that companies can choose which Medigap plans they want to sell, but the plans have the same coverage across each company. I'm sure you're asking, how is that? Well, each Medigap plan is assigned a letter A through N. A plan G, for example, with one insurance company has the exact same coverage as a plan G through another insurance company. This is why you need to work with an independent agent that works with multiple companies to get you the best rate. Sixth on our top 10 list of Medicare mistakes at 65 is missing the Medigap open enrollment window. This is not as common as some of the other enrollment periods and therefore often overlooked. Starting from the first day of the month that you are 65 or older and are enrolled in Medicare Part B, you have 6 months to enroll in a Medicare supplement or Medigap plan with no health questions asked. Once this 6 months Medigap open enrollment period is gone, it is gone for good. From then on, you will be required to pass medical underwriting to enter these plans. For some, this can be a lifetime mistake costing thousands of dollars in out-of-pocket expenses each year and every year after retiring. Not staying in network when on a Medicare Advantage plan is number 7 on the list. If you sign up for a private Medicare Advantage plan instead of Original Medicare, you'll need to use the plan's approved network of providers. This is something you want to be aware of if you are signing up for a private Medicare Advantage plan. If you do not stay in network, you are at risk of incurring out-of-pocket costs or outright denial to pay for your services. Unlike Original Medicare, which you replace when joining a Medicare Advantage program, you must play by a strict set of rules when seeking medical care. The 8th mistake is forgetting to plan ahead financially for Medicare. Do you know your adjusted gross income matters? IRMA is something that cannot be ignored and is best discussed with an advisor. And on our website, you can find the official IRMA chart to help you plan ahead. Depending on your income, you could pay hundreds more per month than others for the exact same coverage. We're getting down there, folks. Number 9 on the list is not realizing that you may qualify for help lowering your Medicare costs. Medicare comes with many expenses. If your income is limited, there are 2 programs that can reduce costs for those that qualify. The Medicare Savings Program may help you pay some or all of your Part B premiums. Extra Help is a federal program that can help you get to low or no cost Part D prescription drug coverage. Our advisors can help you with evaluating if either of these programs may work for you. Lastly, at number 10 on the list, our final mistake is not considering both the Medicare Supplement and Medicare Advantage plans' pros and cons. You have 2 choices to help pay for the cost that you will incur out of pocket when going on Medicare. That is either a Medicare Supplement or a Medicare Advantage plan. One of the biggest mistakes that you can make is talking with an advisor that does not discuss both plan choices with you. When you're signing up for Medicare, you want to talk to an advisor who is going to explain fully the differences between both plans so you truly understand both clearly and how they will affect your healthcare needs, lifestyle, and budget. Working with an advisor that is independent and works on your behalf is best. One that represents all options and several different companies is best. We are proud to say our advisors here are all of those things and more because we offer lifetime support, and that's not something you can get by going to a carrier directly or calling the 800 number on the TV. Here at Strive Medicare, we are able to present you with all the different plans in your area. We have licensed advisors who are willing to stick with you as plans change and help you when you need it. If you need help choosing a Medicare plan, reach out today by calling the number on the screen or scheduling a free consultation, where every day at Strive Medicare, we are making Medicare simple.